Communities in KwaZulu-Natal are still without tap water after infrastructure was damaged by the recent floods. Doctors Without Borders has been assisting some of those affected communities. The organization is concerned that vulnerable communities and health facilities are facing a crisis as far as access to clean water and adequate sanitation. For more on this, we're joined this Sunday by the organization's Sean Christie. Sean, good afternoon or good morning. Welcome to Newzroom Afrika. By your assessment, how widespread is the issue of intermittent or a lack of water supply altogether in KwaZulu-Natal at the moment?
Good morning, and good morning to your audience. Thanks very much for the opportunity. We're seeing a very widespread disruption with no clarity on restoration of that water supply. And so, you know, in Durban South, West and North, there's clinics and there's community shelters for those who've lost homes that are without water and sanitation currently, and this has been the case for coming on for 2 weeks. So yeah, all over eThekwini, you know, it's bad.
And these water tankers that the city of eThekwini and I think the provincial government as well, they've been dispatching those to some of the communities where people don't have tap water. Are they present? Are they there to help people in all parts affected by the floods?
So yes, the municipality has commandeered most of the water tanking capacity in the city, private. You know, what we found is late last week, clinics that had water storage and had been without water were starting to receive a refill from municipal tanking. The shelters that do have storage, and they're precious few, unfortunately, that have that storage capacity, are getting a occasional refill, but there's no sort of assurance around this. So there's a big need for constant monitoring and following up and so on.
And what is an organization such as yours able to do in the interim? I know you're also looking perhaps slightly more long-term at helping with boreholes and the rest of it to make sure that affected communities don't have to wait, for example, for a water tanker that may come by once or twice a day.
Certainly, yes. The immediate need is storage capacity and portable toilets for clinics and those clinics that have no water storage capacity and shelters that have no water storage capacity. So it's dropping off water tanks, ensuring they're filled, putting toilets in place. Longer term, we're speaking with the city's water department about solutions like boreholes, surface water treatment. It's a bit different from other contexts where MSF works, where these solutions aren't as regulated. So this is an ongoing conversation with the city.
Is there a serious risk, Sean, of waterborne disease outbreaks in KwaZulu-Natal?
Always following flash flooding of this nature. So especially when water and sanitation solutions aren't addressed or rolled out in vulnerable communities, the longer that time goes on, the higher the risk. So our medical teams are with the Department of Health and City mobile outreach teams which go to these shelters. And I think those are sentinel sort of, interventions, because they'll start to, if any waterborne diseases start to break out, they'll be picking them up in these communities.
And what would be?
Sorry, go ahead.
Oh, sorry. What would be the most likely outbreaks? I know there hasn't been a confirmed outbreak of any waterborne disease, we must stress, in KwaZulu-Natal, but in areas where people don't have clean drinking water for a protracted period of time, what are the most likely outbreaks that we would have to guard against?
Well, there's, a range of gastrointestinal infections that could come up. You know, the ones we see in other contexts, cholera, dysentery, and so on. And good to stress that this isn't the case yet. No cases identified. We are seeing a lot of under 5, so children in shelters with sort of diarrhea and gastrointestinal disease, but these are sort of isolated incidents, and definitely not just that. Anything nearing a waterborne disease outbreak.
I wanted to ask you about something else that's happening at the moment. I know the Health MEC, Nomagugu Smelane, had said that there will be mobile clinics rolled out to help people, especially who need chronic medication, because health infrastructure has been impacted, in fact, completely damaged possibly in some areas. Are those mobile clinics fully rolled out? And what's being done, for example, for people who need TB medication, people who need HIV treatment, and diabetes?
Yeah, the mobile clinics are being rolled out in the 3 districts, southwest, north. They're going to the shelters to clear the backlog, as you mentioned, of chronic people with chronic conditions who lost their medications in the floods, and to infrastructural damage and the steep challenges of daily living, haven't been able to get their refills. So that backlog is being worked through. It's quite a backlog. There's hundreds of people in these shelters, but the solutions are coming out. The outreach is getting out to communities. Yeah.
And are you able to give us an idea, Sean, of the need as far as people who may still need to be clothed and fed, because many have still not been able to return to work. In fact, entire workplaces have also been damaged or shut as a result.
Yes, so when we do our assessments for water and sanitation, when our medical teams go out, there are always issues around food provision, needs for non-food items like stoves and blankets and mattresses. This is ongoing. There's quite a lot of support communities pulling together to address the food and sort of non-basic essentials side of things, but it's going to be an ongoing need, and once off drops aren't going to be the solution, with no end in sight really. For many of these shelters, those needs will remain.
Sean Christie from Doctors Without Borders, thank you so much for your time and all that you're doing for those communities in KZN.